Good afternoon, everyone, and welcome to session 2 of our social connectedness in a socially disconnected world. So really excited that you joined us today and really excited for our topic today. Here's the deal. You know, we are hardwired for human companionship. We crave that connection with others. And I will tell you myself that during the pandemic, we've all been challenged in wanting to be able to connect with the people that we care about and we love. And nowhere have we seen this more profoundly, and that is in nursing homes, and that is among elders. And so we are really excited for today's topic, where we're going to look at the role of design and what the role of design has in really helping us to really foster those human connections. The Greenhouse Project's theme this year is to go beyond better. And it really is to challenge ourselves and to challenge each other to just push beyond the status quo that says it's good enough, but to go beyond better and to really think, what are we learning? How do we learn from each other and really pursue greatness and really go beyond better? So I am going to do just some real quick logistics and then kind of get out of the way. So in the chat box, as you're joining the call today, the webinar, please go to the chat box and introduce yourself. Tell us who you are, where you're from. Throughout the process, you'll see a Q&A button as well. So if you would like to ask a question, and we will save time at the end for your questions, please put your questions in the Q&A box. And if you're having technology issues, Janet is standing by to be able to address those concerns, and you can put those in the chat box as well. And now I'm excited to invite my good friend and sponsor of this series, Jack York, and the generosity of IN2L. Jack, it's always a pleasure to do something that we both are pretty equally passionate about. So thank you so much for your sponsorship.
Yeah, no, it's such an honor to be a part of something with Emi today, because you put your panel together, obviously without us having any input, and it's always fun for me when there's somebody that I know that's in the middle of the process. And I think, as we talked before, I think Emi, maybe right next to you, Susan, is the world's most interesting woman in senior living. So it's and again, it's I think, you know, IN2L has all been about engagement from a technology standpoint for 21 years now, but it's just one piece of the puzzle. And I think what I love about the greenhouse world is that there's all these intricate pieces of a puzzle that really lead to true engagement. And so again, we love the technology side to it, but the technology side is irrelevant if you don't have some of these other pieces in place. And obviously Emi will be able to speak to the importance of the design and the things that you can do. I think across the spectrum financially, it's not always about how much money you spend, it's how you do things. So I gotta say, Emi is one of the coolest people in the world. So that's perfect that you have her on the series, and IN2L is honored to be sponsoring the event. And how did you say it, Susan? Just get out of the way. So now is my turn to get out of the way. So thanks everybody for tuning in.
Well, thank you, Jack. And I guess what I would say to that is I love the synergy that happens when you're working with like-minded individuals who really want to make a difference. And we were remarking about Jack's logo, and you see the word engage there. And that's really what this is all about. So to now introduce the most interesting person that Jack has met, Emi Kiyota. And Emi Kiyota is first and foremost, she's a friend of mine, and I am honored to count her as one of my friends. But I will read her bio, which is so incredibly impressive. Dr. Emi Kiyota is the founder and director of Ibasho, an organization that facilitates the co-creation with elders of socially integrated, sustainable communities that value their elders. She is an environmental gerontologist and consultant with over 20 years experience in designing and implementing person-centered care in long-term care facilities and hospitals globally. Her current focus is on creating socially integrated and resilient cities where elders are engaged and able to actively participate in their communities. And she has been awarded fellowships to investigate this topic, including the Loeb Fellowship at the Graduate School of Design at Harvard University, Atlantic Fellowship at the Global Brain Health Institute in the UCSF, and the Rockefeller Bellagio Residency Fellowship for a 1-month residency on an innovative response to global aging from the Rockefeller Foundation. Emi is brilliant, but incredibly humble in the work that she does. She has global perspective, and I am just delighted to welcome her to our session today. And to kick it off, I'm going to, before Emi joins us, I'd ask that she show a video. And so we're going to share a video of the Ibasho Cafe. And just to say, this is not a nursing home, but it really is an example of social connectedness with a community context. And so Janet, I'm going to ask you to start that video.
高齢化社会がこれからもずっと続くわけですけれども、そういう中にあって、お元気な高齢者が増えると非常にありがたい。で、そういったお元気な高齢者をどういうところでどういう形で活躍していただこうか、社会のためになっていただこうか、あるいは自分たちの楽しみを楽しんでいただこうかという意味で、非常に大きな意味があると思います。
そこができるまでっていうのはどんな感じだったんですか？
百姓っていうか花作り専門だったの、向こうでもやってたけど、あれが専門にやっちゃったのね、で今自分が怪我してるんだから、今それできないからここに来てやっぱりみんなの顔を見て、自分が豊かになってそういう世界で
高齢者の人たちは昔からの、ね、経験とかそういったものを生かしながら、そして地域で暮らしているものですから、そういった輪みたいなね、仲間意識みたいなものでやってるんだから、そこが一番助かるなと思っています。
僕たちみたいな若者とかは結構元気が、ある方じゃないですか。ですけどおじいさんおばあさんたちの方も若者とは違うすごい元気を持ってて、それを逆に自分たちがもらえるなって感じに思いますね。
I hope you enjoy this. And Susan, can you hear me? I think, am I on the right?
You're good, Emi. We've got you.
Okay.
Yeah, it
Great.
was
Do you have a
beautiful.
slide? Do you have a slide already?
Yes, we have your slide.
Great. Well, thank you so much for the invites today. I'm very excited. Of course, I'm always nervous, but I'm more excited to really share ideas about how to really design social connections, because that's really very close to my heart. And you just saw the video, which was Ibasho Cafe. We have worked with elders in Japan after the tsunami happened, and we created the community hub where they find their contribution in the community. So that is self-sustainably operated, and we designed together with elders, and we actually had a little bit of construction together. And they are running this operation for about 8 years right now without anybody's, just they're not really taking cities funding anything. They're self-sustainable, running the show to really benefit to support younger generations in their own community after the tsunami. So I hope that you enjoy this, the video. So this is one of my favorite picture. We opened this up, Ibasho Cafe. This was the very first day. And this was exactly what we wanted to see. Children just running around and older people are just, laughing inside. But it was multi-generationally done. And to me, that social connectedness has so many different meanings, but meaningful way of social connection is something that I would like to talk about. And I'm very excited about sharing the design, how design actually does impact on people's behaviors. So I'm just going to go through like quite quick outline so you can have ideas about what I'm going to go through for next 30 minutes. So I'm just going to try to cover, and just really the concept related to social connectedness and theoretical understanding. I'm not going to go too heavy on this, but how, just people are talking about, just academics are talking about people place relationship to really capture the essence. And the third one is to introduce design principle in a meaningful social connectedness. And then lesson learned from case studies to really see how the concept was really implemented. And the last one is the next step. So we are at the time of COVID, and we are really suffering from, social isolation because of the shelter in place and social self-isolation and social distancing. And I wanted to kind of revisit just to capture, and we all have understanding about what social isolation is and what the social connectedness related concepts are. So social isolation is an objective state marked by few infrequent social contract. The loneliness is a subjective. So those are two different things. Social isolation is like, do you have a social connection or not? But loneliness is like, how do you feel about it? Do you feel isolated? So that's much more subjective. And what is social connections? It is not only a physical, but emotional connections to others. So when we're talking about social connections, I always want to go back to revisit what privacy means, because privacy is a concept you kind of, regulate social withdrawal in a positive way. And, social isolation and loneliness being considered to be a negative thing, but, some people want to be isolated positively, so that is a solitary. So I just wanted to go through this. So it's not everything is wrong about this, but it is a different concept. So the conceptual framework I wanted to review is that, the place experience is, when we design, we're not really designing a space by itself. We are creating a place experience. Means that when you saw the video, we wanted to create the sense of social, sense of connection to the community, sense of connection to other generations. That's what we wanted to create. So how can we create those experiences? The experience is a product of place, space, and the building, and the program that all connect. So the building part of it, it is really a three properties. One is spatial properties, just like, you know, bathroom and the living room situation is just like, you know, the bedroom is where the bedroom is located, where the bathroom is located, where the corridor is located. And technical property means that it's just HVAC, just like, you know, air and the lights, and we have all these technicals in walls and, you know, air conditioning and all that. And the third one is the sensory properties. You know, that's the buildings that gives you a sense of smell or touching, a warm feeling. Those are really a physical environment. But just like, okay, when you talk about nursing home, let's say, what constitutes nursing home? It is only a building? No, it is actually a person actually who are in the buildings that really makes the nursing home. It is the building and the individual. And I really wanted to review this because a lot of time when we design, we talk about what's good for the elders. So one person can actually interact to the building, but it is different if you were to be just in the same space with other group members. You know, when you're alone, you might feel a little lonely, but if it's in a group, the same space become more active place. And if it's organization, someone who runs the organization, they actually see same place in a different lens. So when the, you know, place are the, you know, just people kind of the pink part of it and the blue one, how that connects, that's where the place experience comes from. So for today's theme is about social connectedness and how can we actually create social connectedness. It is not only about creating a social space. It's much more complex than that. It is spatial, it is technical and sensory properties that you have. It's a building and how people interact. So let's just go back and just step back and just look at how we've designed in the past for the elder care setting. It was institutional, it was very medical model, and it was a collective care. And the design principle was to create the space efficiency, you know, space being efficient, convenient, hygienic, and total safety. That was very important. So we were creating those space experience, the red parts. I can just go back. This was, you know, that red part of place experience was about efficiency, convenient, hygienic, total safety, which is like a hospital, basically. So we learned the lessons that that was not very conducive to a lot of people. So we learned to create the person-centered care, which is much more social medical model, and it is individualized care. And the design principle was more like to, you know, bring awareness of orientation, especially with people with cognitive impairment, safety and security, privacy, stimulation, autonomy and control, social contract, and home-like environment. Those are the, you know, transition of the design. So it was more becoming more like a home-like setting. But how do people experience a place? Sometimes, you know, I really hope that the person who design and also who work in a nursing home or elder care and, you know, other parts will understand it's creating a place is one important perspective, but at the same time, same place become either a movement or the resting space. So we have to be able to understand how, you know, just place become either a movement place or resting place or whatever, just in the middle of it. I wanted to bring this up because when people said, okay, we want to have a single room, but if you have non-consistent assigned staff members, you will have completely different people comes in every single time when you need to do something. And you know, that was supposed to be a resting place. It's a single room and it's how it's designed, but how people encounter with a person who you don't know, that become a very not resting space. And the same thing, it's just like, okay, we want to have social, you know, social place. Why don't we create the living room space? And if we don't really take the consideration of how people use it, what's their behaviors, what we want to accomplish, then that place become supposed to be an enjoyment movement place, but it become either resting or just very ambiguous space. So it is important when we design social connectedness space, then we actually design around that and really think about who's involved and what kind of place that it's involved. So just to give you some ideas, I just wanted to share, this is the picture I took, social connectedness piece. So this was a living room space, and there were lots of older people. So they are supposed to be socializing space, but no one is socializing because it is just a design that doesn't really, just connect people to have a conversation. So I just wanted to make it very clear. So this one is like a space, living room space with lots of people, not very much socialization. To me, this is just a simple, furniture selections and how people actually coordinated the space really in sort of foster people's for the conversations. So again, so this, this space can be used for something quiet by changing furniture and all. But if this is, designed for the socialization, then we have to actually intentionally create the space based on understanding how people behave and who is involved in this. So this is the kitchen space, the dining. I've noticed this was really a nice and large space, and you can actually have a lot of conversation, but again, how it's being used, it is just relatively socially isolated space. It's just not social connectedness space. And this is another one example. This is from Japan. It was group homes. Older people with severe dementia live there. So they are actually talking to each other and they're engaged. So it is a smaller space with less people, but people do socially connect to each other. So why do we need to actually have social connectedness? I actually was just thinking, I just did a lot of Google search and other things and just try to figure out why do we need a social connectedness? It is wired, but but then what's the benefit of it? I think we want to have identity through social connectedness, who you want to be connected, how you want to be connected. So just to create a space with a lot of people wasn't gonna just make it socially connected in my book. So I found this quote in the Bhutan when I was involved in this senior housing design in Bhutan, which is supposed to be the happiest place in the world. This was in an elementary school, and it says, the time to be happy is now, the place to be happy is here. The way to be happy is to make other people happy. To me, it captures quite well, who creates social connectedness, who creates the boundary between privacy and social connectedness. A lot of time organization comes in or designers actually draw the line, but how can we actually create the space where older people draw the boundaries? So that's where the Ibasho came from. So this is, again, talking about social connectedness for the age of global aging. This is like a typical things that you see. It's in Japan. It's Ibasho Cafe outside. This man is 78 years old, and 3 high school kids playing video game when the older people are exercising. So I think we really have to think about what socializing mean for the older people. They're not going to be playing bingos. They want to do something meaningful. They want to help other people. So how can we create that social connectedness? So we kind of just review the institution person-centered care. So this is how I conceptualize. It's inclusive empowerment model, and the design has to be based on the elders' wisdom and community ownership, demarginalization, multi-generational, culturally appropriate, and normal place. When I started to develop this with Dr. Alan Power, when we are doing Rockefeller Foundation fellowship, which was 10 years ago almost, These design principles were just, no one was talking about this. And it hit me this morning when I was talking to a few people to learn about COVID response in certain cities. I was talking to people in San Francisco and Amsterdam, Netherlands, and they're really talking about these issues of like, how can we mobilize elders being a part of COVID recovery and all. And I think that, I think the time is right for us to be able to really think about social isolation in a very different lens. We are not going to be looking after older people. We are going to be empowering for them to just take ownership of what they want to do. So this is the buildings that it's a Ibasho. The people who are so used to Ibasho the presentation haven't probably seen the buildings that much, but this was the day one of the Ibasho buildings. We were, we designed with elders and created this right after the tsunami happens. So this is the floor plans of, our Ibasho Cafe. So I don't know if you could probably see. So we have a lot of design sort of approach, just try to promote socialization. Let's say this is a kitchen counter. It is not, the direction is so that we are getting rid of all this hierarchy. We're not going to put any doors, and it's accessible from other people who are in the cafe to come in and just helpful cleaning and all that. And bathroom is all accessible, and we have a different type of sitting area, and this area connects from outside to come in and inside to go out. Just really try to focus on how we can design. So this is when you go in, this is how it's look like inside. And all the furniture is really, it's movable. So we can make it completely empty, or they can actually put it together to make it seating. And this is how the kitchen is like. So that really get rid of all this hierarchy of who is working there, who is a customer. Everybody is in equal. So this is in the place where it's a Japanese room was developed because they wanted to keep the cultural value going. So this is outdoor, sort of like a balcony, but it is connected to inside, so people can actually go in and out without putting shoes on. And this is a brand new one, so we didn't plan this, but our elders decided they needed to have income generation, so they created a ramen noodle shop. What they did, they actually built everything by themselves. They got permit, everything, to really create it, because that's what the community needed it. So our design principles are Ibasho 8 principles. We created this Ibasho 8 principle again with Dr. Alan Power to get to this. But we also, this was more like older people are valuable assets to the community. It is, you may think that is a program, how we're going to apply for the program perspective, but we did apply to the design also very directly. And I'm just going to go through quickly so you can actually see how that was applied. So elder wisdom, we created, we asked for donation from the people who had this like a wood fire stove in Japan. This is very traditional one. People are actually destroying it, but we decided to save it so that the older people can teach young people how to start fire and cook with fire, because this is an emergency shelter at the time of earthquake. Young people don't know how to do this kind of things, but older people wanted to create this useful function to really help other people. Sense of normalcy, this is how it's like in Ibasho's inside. You can actually see kids playing video game again, and older people, some people are just hanging out, and some people are singing a song, and the person in the back is getting an interview with like newspaper writer. But again, no one has to do the same thing, but it is anybody can come in anytime to just do what they want to do to make that normalcy. We made the space as flexible as we could. So we decided not to have a wall. We have all the windows that can be taken out at the entrance. So this is, and it's a demarginalization. We just try not to marginalize older people. To do that, we have the Japanese tatami mat rooms, which is like people can actually have kids playing upstairs, and now older people who cannot really sit like knee down, then they have a chair at the entrance. So everybody can participate in the space-wise. And sense of community, this is more like a design process. We always work with the older people to decide what kind of space that they want. And this is typical, this is from Philippines. And another community ownership, we created this outdoor space because everybody, when we were involved, they said they wanted to have farmers market and they wanted to create and sell vegetables. So we created the outdoor space and decided to have a tent rather than just building everything up. And this is a community ownership place. So the people own this space, even kids actually. So kids actually like to just create a little space and hide and play as a group. No one stopped that because that's all, it's owned by the community members in equal level. And multi-generational, we took advantage of outdoor space for just any kind of activities. All the activities that they do is for the children. So the older people are the ones take in charge and the children are there. And the space-wise, this is how it's like. Kids like to lie down. So they are just like lying down again, playing video games. And the older person is in the middle and just getting her work done for the paperwork and things. But it is this space really accommodate multi-generational needs in this particular culture. And demarginalization again. So this is in Philippines. This blue door is the place that it's Ibasho, Philippines, but it is in the middle of the city, just the community center. So that's where everybody plays basketball. That's all the kids are gonna be there. So older people negotiated to secure the space. So this person with the yellow shirts, he sits there every single day, protect from kids vandalizing anything, but he's always a part of this. And again, demarginalization, we design in a way that older people are able to participate, cleaning the dishes, making coffee. And the person on the right, she already passed already like a few years ago, but she was 98 years old when we met. And she doesn't cook, but she brings coffee, she brings tea and just contributes to this society. And it's a culturally appropriate. We knew what kind of culture that they wanted to serve and just preserve. So we designed in a way that it is most, again, flexible, but also they are able to host any type of, this is a tea ceremony, but any type of program that they wanted to host. And this is a place that it's resilient. So this is a place where elders teach how to grow organic food, and also the building is evacuation center. So that's where they teach how to, just keep talking about the disaster prevention. And the last one is embracing imperfection. How did we do it? We used to have this floor, and the kids decided that, they just wanted to sit on it and just lie down. So we decided to cover with the tatami mat, which is much softer. And also you can actually see some people wants to be in this like a Japanese room, but wanted to just sit in the chair. So we bought the new chair, and they got rid of one, just a little column, which was not architecturally needed, and they got rid of it because it was very difficult for them to use. So, and also the one, it's this little, it's a kanban, which is called, it's almost like the nameplate of Ibasho. They decided to add it, and also they thought it was bookshelf that it is not stable, so they just changed it. and they wanted to beautify the space, and the elders actually created this garden club to make the space better. And embracing imperfection at the time of COVID, it was nothing, nothing was certain. And elders decided to create a catering business for helping for the single, just isolated elders. So this is how they make, and you will probably flip out if you're like nursing home operators. But again, we just try to balance. If that's what she wants, and if she think it's safe, we will catch you, but she can do it. And also, this is like a catering business that they did during the COVID time for the social social distancing. So that one on the top is the it's unmanned vegetable stand where they actually sell it. It's in the plastic bag, so people just take the whole plastic bag of vegetable and leave some money behind, so they don't have to see each other to just sell this. And this is a catering bento box. Some people comes and they will sell it, but sometimes elders actually bring the bento box to the other elders. So this is also another embracing imperfection sort of ideas. This is the day one of Ibasho Day, and the building grows. So this is how it's like. So, sometimes socializing space, we feel like we have to give them socializing space, but, having them to be involved in creation, it is really important for the socializations. So I'm going to skip this since I don't have time. But I would like to share with you, like, again, socializing space, there is Alvin Altman, I really like it. It's a privacy theory. He always said you have to have an optimum level of privacy for people to socialize with others. If you don't have an optimal level of privacy, and all they want is to look for privacy, and they're not ready to do socializations. So it is balancing is always a problem, and who draw the line, who just decide the boundary. It is something that we should really talk about. And I think design implication for the designers, we really have to be very careful, because when we protect the elders too much, that creates dependency. It provides special service for elders, and that might be creating ageism. And when we create a specially designed service and built environment, that might be create the stigma. And when we just really focus on a specific design, that creates segregations. And the last one is that excessive convenience and high technology usage might actually create the social isolation, because you don't need to. You don't need to socialize with anyone. And the society, this is what I wanted to go through. And why do we need Ibasho, the place like what we did? Elders were normally looked after from the society. And then, but the current modern society, we don't have that family infrastructure around. So what we need is to just really try to help Ibasho, the community with Ibasho principles. And then, this kind of Ibasho can give advice to the cities, so that you can become a part of, just communication and just, placemaking and community development. So aging in place with meaningful purpose, it is, it's a big goal that I am very much interested. And I think, again, a lot of time aging in place, it's only focused on housing, but you really need a place where you can actually hide away from your home. It could be a third place. But I think what we need is a community hub like Ibasho to really build up the community capacity and really become a resilient hub to address the climate change issue. Elders can take environmental stewardship to be a role model for children. And that could be a multi-generational network, and really address social inclusion, especially for the people with dementia. We're not really including them enough. So responding to the COVID-19, what we wanted to try is to damage the social fabric affected by COVID-19 through empowering and including elders to create their own social connectedness in a meaningful way by doing, integrating technology. And it's a really localized project with global missions to really connect to each other and create a safe socializing space rather than just limiting people to access to anything. So this is what I've learned from a design perspective. Sometimes we feel like we have to design for them, but community is something that we have to negotiate and create with others. It is not something that we can passively receive. So moving forward, we are facing to this COVID-19 time, and just really social isolation was not created by COVID. It was there. It just shed the light. But this is a time we have to really think about it and just think about co-creating it rather than just creating for them. So this is Ibasho's way of creating a social connectedness. And thank you so much. Susan?
Emi, that was just fantastic. Honestly, I have so many questions. I think probably the first thing that I want to talk to you about, and then those of you who have questions, I already see some of you have put your questions in the Q&A box, but go ahead and put them there while I ask Emi just a couple questions. I think as I've always heard you talk about the wisdom of elders and really combating ageism and so forth, and you and I have talked so many times about bringing Ibasho to the United States. And I can tell you by all the chat that I have watched during your presentation, that's the desire of many people that are on this webinar today. And it's maybe just, maybe that's not true, but did you have similar ageist stigmas and stereotypes as you brought Ibasho the first time into Japan and then the Philippines and then Nepal? Were the ageist stereotypes as prevalent, ageism is prevalent there as it seems to be in the States, which seems to be one of our big barriers?
Yeah, I think ageism is there. I think there are two types of ageism. Ageism view that we as young people have toward older people, and older people have toward themselves. So those are the two things that we really have to address to get through. But I feel like, just young people are not as ageist as like maybe middle age group. I think, so that to me, that was surprising. But I always feel like we have to combat ageism. I have an issue with that actually, because age, being older is not a bad thing. But once you said we have to combat ageism, it just kind of give you a negativity to it. So what we tried to do through Ibasho was really lift up the spirit and also the experience up high, rather than like, why don't we just go out and just say older people should do this and we have to go against the ageism. We just wanted to lift up what they have.
Well, I love that. And I think that helps to then shape our beliefs about the resilience and the opportunities for elders to give back. And you seem to imply that incredible reciprocity in elders being able to contribute back to their community at large. And I'd love for you to speak a little bit in light of the pandemic and thinking about building resilient communities, thinking about what we have learned during this time and what you have learned. I think what I loved was the resourcefulness in the bento boxes and what your elders that were coming to Ibasho in Japan determined that they were going to do, and how resourceful, how resilient, and how do we tap into the wisdom of elders as we think about kind of building back after COVID-19?
Yeah, I think I must say, if we were to be the operator for the Ibasho, we would have closed that shop. But because it was owned purely by the older people in the community, they knew exactly who needed the care, what kind of service they wanted it. And again, the community members are their friends, right? So it's not like care recipients that they have to look after. They were, you know, purely just try to be helpful to their colleagues and friends and their family members. So, you know, we didn't have to be worried too much because I could trust that when they will say, okay, that's it, we cannot do it, and they will stop. But I think that, you know, just who has the key of that organization or buildings was very important. And also our design, we wanted to create a space that it's open to the community and also flow out from the building to the outside. We made it accidentally, actually, you know, very ventilated space. So they can actually just have that space open during the day with totally isolation place. I think it's the same as greenhouse. You know, we are talking about smaller scale and consistent assignments and all this, you know, the package or, you know, just model that you created happen to be very strong toward infection control. You know, it's just the same as Ibasho, but at the same time, I've learned that it is not like COVID proof. That is like just simply good design is good, you know, so
right.
Yeah, that's how I feel. But I think to me, the building really does play quite a bit of role because, you know, that's the place where they can go. And when you go there, someone's going to be there. So there is expectations. And I think the building is owned by the community members. It makes a huge difference because they can actually make it better, and that's theirs. And, you know, that comes with pride. So how can we sort of apply that knowledge into elder care setting? You know, we sometimes feel like, you know, if we were like our elders one time said, whatever that you decide and you design it, I will complain because I didn't do it, right? So it might be just that the feeling of like sense of ownership. And I think a building has such a great potential for that. And it doesn't have to be a whole building, but think about space within their living room, space within their bedroom. You know, I've seen in a nursing home, I always feel what I look at is like what's in the living room space. You can personalize your, you know, bedrooms, but if you're really trying to do this person-centered, living room should be also, you know, owned by the elders. But I rarely see the elders individual artifacts, and I think that really, you know, it's almost for me, just can we just use that, you know, design as a part of education vehicle for us to really think, so that we think a little bit further, so that, you know, we can really empower older people to actually take actions.
Well, that's the operative word, is that that empowerment and ownership, and to really fight against our own tendency to take over and control and speak for. I'm going to invite Marla into the conversation, because I know as I'm watching the Q&A thing, it's yeah, popping up with lots of questions. So Marla, join us and share some of those questions that have been coming in.
Yeah, there are a lot, so I've tried to organize them. And I think a few in the beginning are pretty quick. So a question on cost. How much did it cost to build that environment? Did you use some outside construction services?
The cost can be very depends on the location and what you do. Japan, it was not too expensive, but it was expensive because it was right after the disaster. We needed to go through a very strict code of, you know, earthquake code and tsunami code and all that. And it was a new construction, but, you know, this Ibasho can be done like renovation of the space. It could be taking over one of the, you know, storefronts or something. Then, you know, the cost will be very different. So I think it depends on who we were working with. If we were to be working with community organization already have a space and wanted to improve their services, then the cost will be minimum. Yeah, so I think it's hard to say, but I think Japan, we had a new construction company because we have to meet the permit and the requirement. But we, I couldn't talk about this, but I think how, we shouldn't perfectly design a space. Who's going to perfect it is going to have to be users. So how much of the, sort of framework that we can create, it is safe enough, but people can actually personalize it. Just drawing a line is the art of architects and the designers. But we really did have a lot of discussion, and we finished it imperfect, intentionally, actually.
Well, and there are a number of design related questions. So one on square footage, and I'm guessing that might kind of depend too on the different Ibashos you've had. But any comment on square footage?
I think that what we had we don't have any requirement. I don't really think that we have to create Ibasho in a warehouse. Well, it could be different, but the place where we had Ibasho in Japan, we had a donation of farmhouse, and we repurposed it. So that was the size, but it is about I think it's a 1,500 square footage maybe for Japan. It's not that big.
And then related to that, how about the noise level in informal gathering spaces? Has there been issues with persons with hearing impairments?
It's very interesting because there is a fight and argument, and older people just like calling to people to be quiet, the children to be quiet. So there is a noise level, but I take it as enhancing communication for people who don't talk to each other really, and who I think they seem to regulate their own way. So we have outdoor and indoor. Interestingly, if you want to have a quiet conversation, like when I go there, I normally sit outside. So there is a regulations, just of like a noises that we could have. So I think I think it was very helpful for the Japanese one, especially that we had indoor environment, but we have very pleasant outdoor environment right next to it. So being able to control the noise level, but also like a sense of privacy. It's a very strange way, but sometimes when you're walking outside, you feel much more private. I have a feeling that you probably have experience if you ever walk in a nursing home. So just like making that regulation just how easy for people. So if there will be a locked door, then you can't regulate it. But if it's not, because it's not locked, you can always choose and transition easily. So those are the things, flexibility and who balance the boundary. If you were to design that based on that, I think makes it easier.
Can you clarify, because there were some questions about, do elders live there? Do they have private rooms? So can you clarify that?
Yeah, this one, Ibasho, the one that I showed, it was a community hub. So it's open during the day. Yeah, so no one lives there. It'll be nice. That's going to be my dream to be able to have that. Or maybe, just work with like places like greenhouse to team up so that you don't do that from the beginning. Because, there is a freedom to have community center license than residential facilities, because then regulation becomes so incredibly impossible to have a flexible operation for the community members.
So how can this be, I'm going to move on from design to a little more on process. How can this be implemented with culturally diverse elders?
There are two answers for that. One, Ibasho, it's a beautiful beauty of it. It's the same as greenhouse. It's a small scale. So we don't have to just create one fits all for 100 people. If 10 people wants to create one cultural thing, they'll do it and we'll make 10 of them. Or if they want it, so we can be much more flexible than like just try to create the meet regulations and requirements about, you have to serve how many people and things like that so far. Yeah.
So what would you recommend how an organization would start to build a community and get elder input? What would you recommend?
I think you really have to be trained to do that. And somehow I actually am reminded all the time. And interestingly enough, I've been getting, when I started Ibasho, I wasn't really thinking about scaling to begin with, really, to be honest. I was just thinking, this is the gap, I have to do something. So nowadays, I decided that finally, with my colleague, I'm just gonna create the training sort of materials so that people can actually be a better facilitators and, training materials for elders to be trained also. But I think, it is, it wouldn't take that professional degree to be able to really simply listen. But I have to say, if you're in the healthcare for a long time, those are the unlearned skill that it takes a little bit longer than people who never experienced, I have to say.
So how is, a question that's I think somewhat related, how would you say it's different or similar to participatory design?
Yeah, I think we do integrate participatory design. So it is not different, I think, it is really co-design, participatory design. I'm not very fussy about the language. Maybe I should, but if it's a good idea, it's a good idea. I think participatory design is one very good idea. I really don't like the fact that, some of the town hall meeting, which is like a lip service kind of meeting, we don't want to do that, so if we listen, we listen. And, we, of course, a lot of design decisions that our elders make. Do I agree? No, for a lot of things. But if we decided this is what we're going to do, then I just needed to let go of my design ego and all the other things. So as, all the team members, it's really tough for designers actually to let go of that piece. But, that's what it is.
Right. There were a number of questions about elders living with dementia. So what does Ibasho look like for Alzheimer's communities? Can you give examples of how the model has worked with elders with different degrees of dementia?
Yeah, I think, so in Ibasho, we had a story that, city mayor actually approached the Ibasho in Japan and said, why don't you do a memory cafe? And our elders said, no, we won't do that. And because they said, person with dementia can come anytime. We don't want to set up the date. And I don't want family members to go through the entrance to say, oh, I have family members with Alzheimer's, so I can go in on Wednesday, 7 o'clock. And it's just stigmatizing. We don't want to do that. If that's something that nursing home wants to do, we don't go against it, but we won't take the money and we won't do it. So basically, it doesn't mean that they don't have any person with dementia. The person with dementia just there all the time. And some of the adult day center, they bring elders, with a severe dementia. But we design in a way that it is actually completely like accessibility was like a must. So I didn't explain about this much because everything is accessible. But for the personalization piece of it, grab bar was something we didn't install it. We waited until elders to use the space and they installed it so that it is completely safe. So in Ibasho, the people with dementia are there, and it could be severe dementia, it could be early stage, but elders, again, community members knows who is who and what they do. And it's just elders were saying that if, someone was saying, what if the elder is gonna escape? And they said, first of all, it is a small space. Second, I can catch them because, the person with dementia runs out. I think I'm a little bit younger than I can actually catch them, but I don't, we never really had that issue. I think we have much more like our own way of preconceived notion about who the person with dementia would do, kind of. But I think community members don't think because they don't really see them as a patient. They're like they're one of their friends with dementia. They have memory issues. That's it.
Nice. All right, there's a few more I'm going to try and get in here. So one is related to COVID. Just the challenge of communal spaces, So let me try and get to the heart of the question. How did you manage this in Ibasho homes? Did you just open the doors? So how did you kind of manage some of the distancing and the needs to isolate more?
Yeah, well, I can't take credit out of that, I have to say. I love to be able to come up with design guideline based on that, how to create social interaction plays at the time of COVID. But everything they did was they really read the requirement and they tested out and make sure that it needs to be done. But at the same time, again, we have to challenge our own way of thinking. They're not professional, they're not experts, public health professionals, but they are retired teachers, retired professors, or retired farmers. They can use their common sense to be able to do that. And also, but I think, our challenge is that if the expert in the city hall or the city government will tell you something, it is correct. But it's just, if someone has the same information, being able to read, and they can actually do it. And yeah, our elders were very careful, but they did it by themselves.
Nice. Well, and you mentioned mindset. So maybe this is the last one, although there are a few more. So how do you create stable, enduring messages around imperfection, especially in a culture like the US that is so centered on safety? And there were a couple comments. This person is referring to the woman on the stool. Somebody else said that would never happen in the US. So just kind of talk about that mindset around imperfection and our focus on safety.
Yeah, well, talking about the culture and then perfection, I think Japan will probably be worse than the US, I think the culture-wise. But I think how to balance it, it's hard. But, we just have to, like, I have to just trust the elders to decide, who takes risk. So again, I'm not the one who's operating it. I don't have a liability issues. The liability issues are elders. And elders are not stupid. They live for a long time. So, stepping up like that, the people around, if she is not stable, they won't let her do that. So, but at the same time, they don't want her to feel like, they're just like restricted. So I think it is a constant negotiations. But I think, again, because this is run by the older people who know each other, they were able to do that, stepping on the top of the chair. But, don't we all see that at home? Like my mom will do it. But, from where we can't have that natural things happen, So, but I think it is, we probably need a little bit more discussion moving forward. But, I'd like to be able to just make that as flexible at this moment. So that's a part of the reason why we didn't choose to make this as a license of residential care, because, we wanted to have that kind of activity going.
All right.
Well, thank you. This was, I think we could go on and on and on. And Emi, we put your email into the chat box. So those of you who would like to get in touch with Emi, please feel free to send her an email. You can find out more about, you referenced some training materials and so forth. So I'm sure that there are people that will want to reach out to learn more about that. And the other thing, I'll invite you to listen to Elevate Elder Care, the Greenhouse Project's podcast, in which Emi was episode number 37. And so wherever you find podcasts, Apple, Stitcher, Spotify, you'll find the Greenhouse Project's Elevate Elder Care podcast. Our next session is on we'll go back to the one for session 3. We're going to let's dive into the role of technology to really figure out what technology has been able to do to foster those connections. In one of your slides, Emi, it says, that social connection is the physical connection as well as that emotional connection. And so how has technology enabled us to have some of that emotional connection? And I will tell you, we don't have a slide for this, but session 4 of this series will be done by Dr. Al Power, a colleague of Emi Kiyota's, and they were in that Bellagio residency, that fellowship together. And he's going to really go where the last question left off, and that is looking at the dignity of risk. And really, how do we balance that autonomy and that need for safety? And so he's going to tackle the hard question that Emi just kind of whet our appetites to think more about. Emi, this has been a delightful way to spend a good part of my day. And I have so enjoyed the collaboration, and I look forward to the future collaboration that we will have with you and your amazing, brilliant work. So thank you so much for joining us, Emi, and thank you to all of you who joined this incredible presentation today. And you will get a copy of the recording and the slides. So thanks for joining us. Take care, be well.